Whether you are on a nutritional diet kick, or taking a supplement, or taking a prescription dietary medicine, you always have to include exercise or some form of activity for this to be successful and sustainable. I meet in the immediate care center a lot of folks that will be on phentermine. Phentermine is anorexic. It's a diet pill. It's a stimulant. It comes off of the class of medicines that are considered amphetamines. And when you use the medicine, the positive side effect is it decreases appetite. But the bad side effect is that it speeds up metabolism, fast heart rate, palpitations, high blood pressure. So for its use, if you combine the medicine with a nutritional plan and an exercise routine, then your success rate is great for a short amount of time. I can't tell you how many people I always run into. They're on medicines indefinitely, and I ask them about diet or nutrition or exercise, but don't have time right now. So the caveat is that when you use medicines to stave off or control appetite during the morning or the day, that's great. But the brain's going to catch up sooner or later, and you usually can't use a diet pill, that one in particular, at night because it'll keep you up. It's a stimulant. So when you stop it or it wears off in the evening time, guess what your brain's going to do because you didn't eat all day? It's going to make you hunt. It's going to think you starved yourself, so it's going to say search for food. It's a cortisol reaction. Make you hunt for bad things. Not only bad things, things that will increase calories really quick. Those are usually carbs or sweet food, salty food. And as most of you know, with elevated sugar levels, high blood pressure, high cholesterol, sweet and salty is not necessarily equated with health. You can indulge every once in a while, but not every night and massive amounts, because when your cortisol goes up and your hunting reflex is on, you won't stop when you're full. You'll keep on getting more and more food in, so you got to be real careful. There are other medicines that are used nowadays to also help as anorexics or decrease your appetite. Phentermine is one. There used to be one called fenfluramine or pondamine, but it was stopped because it was associated with leaky heart valves and pulmonary hypertension. When it used to be in combination with phentermine, it was called fen-phen. Some of you can Google search, or some of you might remember those two medicines together. And there's controversy whether it really caused problems with the valves or pulmonary hypertension. But bottom line is, again, people were abusing it. Doctors were abusing it by giving patients with overweight problem or obesity the medicine and saying, try this and come back and see me in 3 months. That's not the way it goes. You can't just give a pill to get sleep. There's no pill that helps with sleep. There's no pill that helps with getting you to lose weight. The way to lose weight is a combination of what I mentioned. There are other medicines now that just got approved in 2013. One of them is Qsymia. Qsymia is used to also decrease appetite. It has phentermine in it. And Qsymia also has something called topiramate, or a medicine that's used for seizures. A lot of the chronic pain doctors will use that medicine for headache control. With its side effects, though, there's a lot of side effects that come with it. So when you use the combination of the headache control medicine, which decreases appetite, and the phentermine together, great. But again, if you just use the medicine because you are overweight and have headaches, and you don't put anything, if you're just using the medicine, don't do any nutrition changes, don't do any movement or activity increases, you're going to be on the medicine forever. There are studies that show phentermine, the old-fashioned one, can cause a withdrawal-like problem if you stop it. To me, that means it's addictive. Whether it's behaviorally addictive or physically addictive doesn't matter. There's a dependence to it. I think that when we give it to lose weight before a wedding, or to lose weight before your big trip to some other beach in South America, you're shortcutting the way you're supposed to lose weight for health to get to one destination point, which will be looking good on a beach. And no matter what your intention, that is a medicine that has side effects, and it should be used wisely. There's another medicine called Belvique that was also released. Who knows? I think this has its own class, but it is just full of side effects. Almost the same side effects as Chantix for those of you who smoke. Hallucinations, irritability. Even there's other. You can look online for the side effects, but I'd never use any new medicine released by the FDA in the first 5 years, because usually during that time your fallout will be deaths or withdrawal of the medicine, like Celebrex was withdrawn because of the heart disease. I would just wait at least 5 years if you're thinking about that medicine. That seems to help for people who finish up shifts late at night and binge after they work or in the evening. But still, I'd be careful if you're looking towards that medicine. There are other herbs that you can use, like Garcinia cambogia. In very, very small trials, it has had modest improvement compared to people that are losing weight and exercising and with nutrition changes. When you use the Garcinia, check out Consumer Labs. I've referenced them before. They showed some modest improvement. 5% decrease in body weight by the end of 12 months. 5% if it's worth it to take the medicines, probably okay. Gymnema sylvestri, fenugreek. There are other herbs that are out there that sometimes help with, again, decreasing the appetites, or working as almost like an appetite suppressant, changing around leptin and ghrelin hormone levels in the body. Again, bottom line is that if you need anything of a supplement or a prescription medicine to jumpstart you, fine. You can also invest in going to a weight loss center or a multidisciplinary like a boot camp to also jumpstart you. The benefit of the boot camp is you'll go away with not only weight loss compared to any medicine you're using, you'll also go away with knowledge about what kind of exercises work for you, knowledge about nutrition changes that work for you, and then also a good group of people that you might be able to rely on after the boot camp is over. Usually it's a 12-week boot camp. I'll put a link to the one at First Health Associates, very successful. No matter what you choose, I would usually do that before you go on to getting bariatric surgery. I think there's some people who need the bariatric surgery, again, to jumpstart. Some of the surgeries are reversible now, especially the cuff or the sleeve, but many of the surgeries like the Roux-en-Y, irreversible, and you'll have dumping syndrome. But back in the 90s, I had the first 5 or 10 patients that went through the bariatric surgery program at Central DuPage Hospital, and half of them did good. The other half kind of lost weight, but they gained the weight again because they figured out how to get around the small stomach as far as appeasing their appetite, hunting for food in smaller volumes. So no matter what, nature always finds a way. Your brain will always find a way to get around your techniques that you learn or the pills that you take. That's why it's just so much better and more sustainable to not just rely on those medicines or supplements, but to also incorporate some form of activity, some form of nutrition change, and as most of you that come to my lectures know, some form of relaxation therapy or a relaxation practice. Meditation, hiking, breath work, getting out to nature, doesn't matter. Hire a coach if you can't figure it out, or watch some videos online. The idea is to make sustainable changes without too much harm coming to you in the form of prescription medicines.